So today we'll discuss certain important topics in infection control management. So exams are tentatively from the first week of September. Okay, students who are the previous batch students who are attending the classes. Okay, not for the new students. New students can still see the presentation still in this class. Those who have joined recently, their exams will be in the month of February. But this is for the students who have spent at least 3 months in training for them. The September exam is coming. Okay. So first, the structure of infection control in terms of the organization, the team. Okay, page number 7, you can check the organization of infection control. The leader of the hospital, then the senior microbiologist, so on. Okay, that's the hierarchy or organizational chart. And the team, infection control team, microbiologist, infection control nurse, infection control officer. This is the basic structure of infection control. Okay. Then the next topic is surveillance definition. Okay. All the other paragraphs in this first chapter, just read through the understandable concept. Okay. Surveillance definition. What is surveillance? Definition is given on page number 9. Okay. That is important. And also healthcare associated infection. What do you mean by that? Page number 9. Then on page number 10, there is a list of high risk areas. Very important. Okay. You should know what all are the exact areas in a hospital that are considered high risk in terms of infection control. Okay. Then you have standard and transmission based precautions. 14, page number 14 onwards, you will see 2 pages are just of standard precautions. Then coming to 51, page number 51, you will see the transmission based precautions. Both these part are important. In between is the PPE, personal protective equipment. Okay, that also sequence and all is important. We'll come to that. Okay. Then success rate of hand washing. Each part of your hand, fingers, back of the hand, nails, palm. Okay. Success rate of a good hand washing is given. That is important. Who, how, and when hand washing has to be done. Page number 17. Then 5 moments of hand washing, very important. These all are self-study topics, okay? Since those who are already in hospital practice, you know these areas much in much detail. Okay, so just go through, read through it. Then surgical hand washing, page number 25. PPE, the sequence of wearing PPE, donning PPE, okay, and removing PPE. These two sequence is important. What will come first? Okay. Then selecting a mask. In which situation, which kind of mask should be worn for tuberculosis or general procedures in airborne transmission? Okay. So which kind of mask has to be worn? And about N95 mask also, there is a topic. Page number 47, 48. Important. Okay. Then collection of blood samples, page number 40. The quality standards and the SOP of how do you follow it is given. Page number 49, 50, disposing needles, safe handling of needles. Page number 59, isolation policy. Visitors policy is very important in this chapter. Healthcare associated infection, page number 62 to 77. Entire topic is important, okay? COT, CLABSI, WAB, SSI. Okay, all the healthcare associated infection. The bundle of care is also given in this chapter. Everything is important, very important chapter, the entire chapter. Okay. Then HVAC system, heating, ventilation, air conditioning. Okay, page number 78. Then you have the negative pressure rooms, page number 79. What do you mean by negative pressure room? Ideally, what cases are kept in a negative pressure room? Okay, what is the pressure that you have to maintain here? Okay, how much air exchange is important? Okay, how many air exchanges should be followed in negative pressure rooms? Then you have positive pressure rooms, 80 to 81. What is a positive pressure room? What kind of patients would you keep in positive pressure rooms? Okay, the pressure that has to be maintained, air exchanges that takes place. Okay, lighting, noise and all used in hospitals and ICUs. Okay, what are the luxes of lighting used in general care, specific care, in patient care? Okay, noise, what is the permitted limit of noise? Tables are given, you can just go through that. Water, the uses of water, how many liters of water is used. Okay, the storage areas of water, water disposing the sewage water. Then you have cleaning, disinfection and sterilization. All tables, types, methods. All tables important because when you read the tables, you will understand the practical use of it. Okay, what the practical approach towards cleaning, disinfection and sterilization. Equipment wise, device wise is mentioned. Dilutions and all is also mentioned. Then types of sterilization, different types of disinfection, types of cleaning. Okay, in detail in classes we have explained, you can just check that. Methods of disinfection. Laundry, table and steps have to be mentioned. Housekeeping zones are important, okay, in housekeeping services. Standard procedures table, zones. Spillage, the formulas are given. Just go through the formulas, okay. Page number 134. Biomedical waste, segregation, color codes, disposal. All these tables are mentioned. Today we are discussing the important topics from biomedical waste management chapter. Segregation, color codes given by WHO, a table is given. Okay, ways of disposal, okay, flow chart is given, and also another table is also given there. So just go through it. Then CSSD, different zones in CSSD, steps in CSSD, steps of procedure, CSSD cycle. Then occupational safety, prophylaxis, what medications should be given or what vaccination should be given after exposure. Okay. Needle stick injury, protocols to prevent needle stick injury. Okay. And once it happens, what to do. Okay. These protocols. SARS, just read through it. Okay. Severe acute respiratory syndrome. Then microbial stewardship, policy, specific organisms and treatment, microbial policy in hospital. Okay. MRSA, VRE. Okay. Uh, multi-drug resistant, broad spectrum bacteria. All these certain explanation is given for each. Just go through it. Outbreak investigation steps. Outbreak investigation, not the last part, the first part. In two parts, outbreak investigation is given. Okay, the first chapter is in the first part of the book. Okay, the another chapter on outbreak investigation is given at the last, not the last chapter. Read the first chapter. Okay, that is in much more detail. Then kitchen management, different temperatures at what different types of food has to be stored, how it has to be handled. Okay, how you will store the different vegetables, fruits, milk, at what degree, okay, what temperature you have to maintain. Food handlers, what kind of medical examination should be done, okay, how to document and record the what all needs to be documented and recorded. Food handlers hygiene, so that comes under kitchen management. So this is just a sample question you can understand here, which is not a high risk area. Okay, the options are ICU, OT, kitchen, administration. So administration department, this is where billing, okay, these miscellaneous activities are taken care of, accounting, billing, IT, okay, maintenance. These are administrative departments. Okay. So this is not a high risk area, but ICU, OT, kitchen, they are high risk areas. Okay. Then intermediate level disinfection. Three options are given. What does intermediate level disinfection do? It inactivates all bacterial spores, inactivates all microbial pathogens except bacterial spores, inactivates most vegetative bacteria. So if you have read the chapter, you will know in intermediate level of disinfection, all the microbes, pathogens except bacterial spores will be destroyed. Okay. For bacterial spores also should be to be destroyed, you will require high level disinfection. Okay. And sterilization as well. So that's about the important chapters. Is it clear to all?